the first thing to do is to find out what type of hip you have in and what bearing surface you have. And the best way to do that really is to contact your local NHS trust or the hospital where you had your operation to find out the bearing surface. They will have a list of the operations and what you've had done. They can go and refer to your notes, and then they'll tell you what sort of hip replacement you've had. From that, we then would start investigating and seeing whether you're in the group of patients who we think there may be a problem with their hip. And that will involve various things. It'll be a clinical assessment to see how your hip's doing, and they may have a scoring system which we mark out of 100. That asks things like, can you get out of a chair? Are you getting pain in your hip? What are your daily activities? And you'd also may be asked to provide, have some blood tests. And these blood tests will look at the metal ions, because as these metal surfaces rub together, they release the metal ions. And one of the tests that we can do is that we can do a blood test to see whether or not the hip is actually wearing out or if it's working properly.
And we've now sort of screened so many patients, we have a really good idea with a blood test what is normal and what is abnormal. And we've gone around the world to sort of highlight this. And I think it is important when patients have blood tests done, or GPs have done them, or specialists, that there is a really good understanding of what the blood tests mean, because there's different units are used, a lot of confusion. But what we use is a sort of standardized blood test, and we use cobalt as the best measure. And if your hip is functioning well, your cobalt level is usually about 2 parts per billion, which is 2 micrograms per litre. And it's important to recognise that that's a sort of 2 is the figure. Now the MHRA have come out with a guidance saying if your blood tests are above 7, that there's a problem. But it doesn't mean 7 is normal. Basically 2 is normal, 7 and above is very abnormal, and if you're in between 2 and 7, that means you may have a problem. So it would be wrong for specialists, GPs, patients to think, oh well, my level's 6, I'm fine. You may have a problem. And it's used just as a guide to who should be investigated.
If any of those are high, if your scoring system is very low or your blood levels are high, then we tend to investigate it further with an ultrasound scan. An ultrasound scan of the hip is a bit like the jelly scans you have when you have babies. It doesn't involve any needles, and it just gives us an idea of how much fluid there is around your hip. A bit like when you have a swollen knee when it's sore. If your hip's sore, you have some swelling around there. If we then need to investigate that further, we would then probably take some fluid off your hip, and we would do that by, in theatre, under local anaesthetic, popping a little needle into your hip and taking some fluid out, and that gives us again an idea of how well your hip's performing. We would then see you in the clinic, usually by a doctor, with all the results available to us, and then we would discuss if they're abnormal, these results, how we might go forward. And that usually is just talking about revision surgery, which is redo surgery.
We're trying to identify patients early, because we think if we operate early and change the metal bearing, we can avoid them getting into big problems. Because if you leave things for years and years, then everything gets destroyed. And sometimes when we take the hip out, if it's left too late, you get a very bad result. And we're trying to pick the problem up early, operate early, so patients get a good result.
Each operation has risks, so we need to work out for every patient the benefits and the risks for each operation. The benefits obviously are to take the metal bearing out. The risk factors are the risk of revision surgery, which obviously we would discuss at the time. But we feel that if the scoring system is low and if the hip is not working well, then it's often best to take this hip out earlier rather than later to try and prevent any problems that might occur.